I'm Dr. Charland. This is Sabino, Dr. Mullikin, and Dana's horse, Pumpkin. And today we're going to talk to you a little bit about bandaging and wound care. So first, Dr. Mullikin is going to go through a few bandage supplies that you may want to keep on hand in case of emergency.
Alright, in order to do some bandaging, you're going to need a couple materials from your veterinarian. Starting with vet wrap, a combine made of cotton. This is an ABD pad. You have some cling, duct tape, and elasticon.
So this year we've been seeing a lot of abscesses, so you may notice your horse coming in from the field favoring one leg or the other, and usually they're quite lame. And if you may notice an increased digital pulse or some heat in the foot, but the first thing you should do would be to call your veterinarian.
So if I get to the barn and I find my horse lame, what is some of the first things that I should look for?
So the first thing you want to check is evaluate the limb that he's laying on. So you can check the limb for any abrasions, wounds, cuts, scrapes, anything like that. You can also run your hands down the limb and check for any swelling, heat, and then next thing you can do is check for a digital pulse. I like to palpate it right above the fetlock here and just use my hand, these two fingers, and gently apply some pressure on each side. If it's increased, it'll be very easy to palpate, and if it's very difficult to palpate, that's closer to being normal. You can also check for heat in the hoofs, so you put your hand on this hoof and compare it to the other side, and if it's much warmer, that indicates that we've got something going on in the hoof.
So if we came out to examine Simeon, he was laying on his right front limb. He had an elevated digital pulse, as Dr. Mullikin showed you how to feel. There was some heat in his foot, as well as he was sensitive to hoof testers on his foot. So we plan to treat him as if he has an abscess.
And how would we start a foot bandage for an abscess?
So Dr. Mullikin is going to go through some of the supplies we have for a hoof bandage, and then we'll demonstrate how to apply a hoof bandage to Simeon.
Okay, so some of the things you'll need for a hoof bandage are, we like these animal index pads, and they look a little bit like this. So they're kind of shaped like a hoof, and you can simply moisten them with some water and put them on the bottom of the hoof. Or you can do Magna Paste, which is an Epsom salt-like product, and that'll help draw the abscess out of the foot. So once you either do your Magna Paste or your animal index pad, I like to use cling and vet wrap to keep it on the foot. So cling is like this roll gauze, and so you can gently unroll it over the foot, and then to keep that all in place, I like to use vet wrap. And after the vet wrap's in place, you can make a hoof bandage using duct tape.
So Dr. Mullikin is going to demonstrate making the duct tape boot for the bottom of the foot. Simply take strips of duct tape on a flat surface and overlap slightly, forming a large square. Once you have a square in one direction, you're just going to make similar length strips and lay them across perpendicular, all the way across, just to strengthen the boot. Once you're finished with your square, you can cut 4 lines at each corner, as Dr. Mullikin is demonstrating, and this will allow you to fold it up the hoof a bit easier. It's harder than it looks.
Take some patience. Finished.
So since Simi is 29, he's an older gentleman. He has some arthritis, some aches and pains, so we just be very careful when applying the bandage to keep his limb low at a height that's comfortable for him. So Dr. Mullikin is first going to pick up the limb. Holding it low to the ground, she's going to apply the Animal Intex hoof pad that's been moistened with the plastic side away from the foot. and then lightly bandage it onto the foot using the cling gauze. It's important to get the gauze up over the heel bulbs as that will help it stay on to the foot, but it doesn't need to be tight.
And what would be a good thing to use as a guide not to have it on too tight?
So a good way to check if it's too tight is you need to be able to get your fingers in between the top of the bandage and the skin. You don't want to be putting too much pressure on the skin. You don't have to worry too much about the pressure you're putting on the hoof itself. So then she's going to use the vet wrap just to get everything held together and roll it on in a similar fashion to the cling gauze. Another option if you don't have any padding is you can use small diapers you can find at the grocery store, sometimes nice to hold things onto the foot. So as you can see, she's getting the vet wrap up over the heel bulbs and then covering the entire bottom of the foot. So this is a full bandage, but in order to keep the horse from walking right through this bandage, because that padding will wear away, we use the duct tape boot that we showed you previously and stick it to the bottom of the foot, as so. And then use the corners that you cut so that you're able to fold it up around the foot. You don't want to get any duct tape on the skin. Your horse will not appreciate you pulling that off of his hair. So once everything's folded up, you can put the foot back down on the ground. Check, make sure the vet wrap isn't too tight around the skin. Perfect. And then if there are any weak spots on the bandage or places where the duct tape didn't get, you can make a few more strips just to strengthen the toe. Yep. One other option you have if your horse is going to be around shavings or a lot of dirt is to use a small strip of elasticon very loosely. Again, you don't want anything too tight on the skin, but just a loose piece right around the top of the bandage to make a seal so that no shavings or debris will get down into that bandage. And he was a very good patient.
So what is one of the first things I should do if I find a wound, maybe puncture on my horse's leg?
Sure. So the first thing you can do, if you can do it safely and the horse is really calm and not super nervous and anxious, you can try to take a picture of the wound for your veterinarian. And then I would definitely call your veterinarian. But while you're waiting for them to get there, a couple of things you can do are to try to cold hose the wound to clean it out, and also to provide some cold water to decrease some swelling and inflammation.
So if your veterinarian comes out to assess a wound, decides it's not near any important joints or synovial structures, we may just have you keep the wound bandaged in order to keep it clean and allow it to heal. So Dr. Mullikin is going to demonstrate how to apply a distal limb bandage to Simi's other leg.
So we're going to pretend that the wound is right on the dorsal part of the cannon bone. So you can take your ABD pad and just gently place it. And if there was a wound, you definitely want to wear gloves if you have them. So then you're going to take your wrap or your cling and just start it right over your ABD pad and you want to make sure that you go from the inside towards the outside. And that rule applies on each limb. So if it was on this limb, it would be inside towards the outside, so clockwise, and on the left side, it's going to be counterclockwise. So without applying much pressure at all, just like gently wrapping around the limb, you want to wrap this cling all the way around the ABD pad to cover it completely.
And if we did not have sterile bandaging at the barn, would it be okay to use a clean standing wrap to get by till the veterinarian could get there?
So we usually recommend having at least one layer over the wound that's sterile. So if you even just had the pad and the gauze, if you didn't have a sterile combine, you could then use a clean standing bandage to cover the entire bandage.
So that is something that every horse owner should have at least one at the barn in case of an emergency.
Yes, on top of the bandaging materials we showed you that may be handy to keep around the barn, always having a standing bandage in case you need to use it would be helpful.
So when applying the combine, it's the same idea. You want to start inside to outside, so this will be wrapped counterclockwise. And without applying much pressure at all, just gently circling the limb. Next, you'll take the vet wrap, and it's easiest if the vet wrap is the flat side down. So when you wrap it, you can put it between the layers of the combine and stretch it about 50%.
And should we start in the middle of the leg?
Yep, that's the easiest place. So you'll stretch it about 50% and then overlap your last wrap from before. And you'll go all the way down, leaving about an inch of combine exposed. You want to make sure there's no creases or wrinkles in your bandage.
And then you start your wrap back up the leg?
Yep. So once you go down, you'll start in the middle, go down, and then come back all the way back up. Again, leaving space at the top of the combine.
And Dr. Mullikin, how much pressure are you putting on that bandage?
I'm only stretching about 50%, and if I do apply pressure to adhere it to the combine, you only want to apply pressure to the dorsal part or the front part of the limb.
So that would be bone.
Yep. So it's going across the cannon bone and not the tendons, which are on the back side of the limb. So just about 50% stretched. This would be not stretched at all, and this would be really 100% stretched, so you want even in the middle.
And then, like our foot bandage, we're going to use a small strip of elasticon both on the top and on the bottom. Again, very loosely applied, sticking about halfway on the skin and halfway on the bandage in order to keep anything from getting down into our bandage that could potentially cause a bandage sore.
There you go.
Now Simi is all bandaged up, so his wound will stay clean.
So if you have any questions about our video today concerning wrapping and bandaging, please call the clinic. Every doctor there, technician will be glad to help you and answer your questions.